So hello, good afternoon to you. In India, it is about what's the time? It's about 1:20 p.m. and it would be later in the day in Australia and New Zealand, and England would just be getting up, and USA and Canada are still sleeping. So now we go on to discuss about an important topic of which I've been getting a few questions of late, because suddenly my old video on beard hair transplant popped up on search, and therefore I'm getting these questions since last 2 or 3 days on beard hair transplant. So when we talk about beard hair transplant, it's very important to differentiate two types of beard hair transplants that people are usually talking about. Most of the patients, when they seek a beard hair transplant, talk about a deficient beard, a beard which is not grown enough, though they are in their early adulthood and they feel quite conscious about it, and they want to restore their beard. So this is one, this beard restoration. The other thing that commonly people search for beard hair transplant means that harvesting grafts from the beard for extensive baldness for use on the scalp. Grafts taken from the beard, the shadow area, or in Caucasian skin, even from the cheeks, are used in cases of extensive baldness to increase the number of grafts in one session if we want to cover greater grades of baldness, like grade 5, grade 6, and grade 7 baldness. So these are the two types of beard hair transplants that usually people talk about. So today we are only talking about beard hair transplant to restore your beard. That is beard hair restoration, not harvesting grafts from the beard, which we have talked in another previous video. And we'll cover it up again in a live session later on as well. But today we are talking only about harvesting beard grafts from the beard or the scalp to use them to restore your beard. So the beard is an important part of male identity. Most of the people are happy in shaving off the beard, but even in those patients who shave off the beard regularly, even in them, lack of hair on the beard is a big thing, because even if you shave your beard very closely, still an outline of the beard, the shaved beard, is still seen. Whereas this is not the case in patients who have beard alopecia. Their skin seems just like baby skin, and they want it to be restored to get a masculine look. And beard is indelibly linked with masculinity, male masculinity, as you may know it. And then there are patients who sport a beard, whose families sport a beard traditionally or in their society, beard is a done thing, that everybody sports a beard. Or if you talk about certain religions like Islam gives priority to the beard. Most people who are who are Muslims sport a beard, and then there are many other religions, of which one is the Sikh religion of Punjab, in which I am here, and now Sikhs are all over the world, that who usually sport a beard, and they would like to get their beard restored before they wear a turban, because a turban, when they wear, doesn't look proper if there is a subpar or a poor growth of the beard. So these are the types of people who come seeking a beard hair transplant. But nowadays, a lot, because beards are in fashion, a lot of youngsters, even as young as 19 or 20, in whom the beard has not yet fully formed, who are impatient, want to get a beard hair transplant. See, beard hair transplant is only done if you are deficient of beard after you have given nature or your body to grow your full beard to its maximum potential, which happens anywhere between 21 years and 25 years of age in a normal human being. But there is a very small amount of percentage of people who do not get beards because of certain genetic reasons. It runs in their families that they don't have beards, or they do not have lush beards. They might have a goatee type beard around the chin, or they might have a beard which is an extension of the sideburns and nothing else, or just a mustache and a little bit of mop around the chin. But they want a full beard which is all along the cheeks, the chin, and the mustache. So these are the people who come seeking a hair transplant, but today's youth is very impatient. Not only impatient, they are impulsive. They take decisions thinking that they will get a quick fix solution by fixing their beard, everything in their life will get fixed, which is not so. It is your character that you have to build up, your personality you have to build up, not your beard, which will make you sail through. Not your nose, not your hair. These are just excuses. So when you are young, say when you're less than 21 years of age, when you're less than 25 years of age, you should think twice before going for a beard hair transplant, and I'm going to tell you a whole list of reasons why. Give nature a chance to let your beard grow. There are certain medical treatments also available which you can try, but patients want quick fix solutions, as I said. And so when we take decisions in great haste, when we're in a hurry, we want to copy the beard of our football star or of our film actor whom we look up to, and we want it done fast, we might take bad decisions. Because for every 10 people who want a beard hair transplant, when they're not candidates for it, there are 20 clinics waiting for you to come and seek their help. So there is half a chance that you will land up in a problem. You land up in a clinic which will not tell you the pros and cons of a beard hair transplant. And you might later on repent about the decision, the hasty decision that you took in childhood or in early adulthood. Because you have to remember that hair transplant is a cosmetic surgical procedure. And cosmetic surgical procedures are not salon procedures. Cosmetic surgery procedures, once the knife touches your skin, is permanent. There is no going back. If you get a bad hair transplant, if you get a bad beard hair transplant, it'll take a lifetime, if at all, it'll take a lifetime for you to fix the bad result and get a semblance of a natural look, if at all. Because it is everybody looks at you at the face, and face skin shows scars very easily from a distance. And face is one thing you should think 10 times before going in for any facial hair restoration procedure. So then we go on to what are the patients who come seeking a beard hair transplant. The types of patients: number one is the patients who have a total loss of beard, total alopecia of the beard. And then we have patients who come with thinning beard. They just want to add density. They are the simplest type of people. Most people with this indication will be very happy because you're adding density. Whatever hair you put is going to be camouflaged by the existing hair, and they are the ideal patients to do hair restoration for the beard for. And then we have patients who have beard patchiness. The patchiness may result because of congenital patches. Some people have patches over the cheeks here. Some people have patches over the chin, or there's a bald spot over the chin which they want to be restored. Or there could be patch which is secondary to cicatricial reasons, scarring. Scarring could be because of burns, scarring could be because of injury, and scarring can be in Sikh males because of traction alopecia. If you tie your hair too tight in a bun below, or you fix it up and with a pin underneath, and the hair gets pulled over many years and there's a bald patch because of traction. And this also is a common indication for a beard hair transplant at my clinic because of the place that I am situated, that is Punjab, where people mostly sport a beard very proudly, and they tie the beard in various fashions which might cause stretch, pulling, scarring, traction alopecia. So this is it. So what are the approaches to beard when patients come to us? See, when you have a thinning beard, the beard is fully formed, only it is thin or sparse. There are no patches though. it is diffusely sparse. The sparseness is spread out equally. You can add scalp grafts very easily and they will merge, give density, and it will look very, very natural. And the patient's result is very fulfilling both to the patient as well as to the surgeon. But on the other hand, if you don't have much of a beard, the texture, the quality, the color of the beard hair has to match the hair of the other areas of the beard where there are hair present. The hair that has been transplanted should look like beard hair. Beard hair are usually thick. Beard hair are not as straight as scalp hair. So they have the unique characteristics which need to be copied, and therefore, if available, most patients who do not have a beard or have a little bit of mop on the chin area, but they have quite a bit of beard in the submandibular area, you usually will find it that way. This hair in the submandibular area can be harvested and mixed with scalp grafts to give the patient a beard, low density, which can be built up over time. This is the second category of patients. And the third category of patients who do not have beard at all. There is no beard in the submandibular area. They are clean, just like a clean shaven look. So in these cases, the decision can be a little bit dicey, because the hair that we take from the scalp are hair which are of different nature. They do not resemble hair in the beard area, which you commonly find in the beard. These hair are straight hair. Straight hair in the beard, in most cases, look unnatural. So this is a decision the patient has to take, and commonly I tell the patient to get a test grafting done of about 10 grafts, and then see the shape of the hair, see if there's any unnecessary scarring, and take a decision after 6 months, a considered decision rather than a hasty one taken impulsively, because there's no going back. And then the last category of patients is patients who have various degrees of baldness, various degrees of thinning of beard or total alopecia in a setting of existing androgenic alopecia. They may be bald or only thinning, or they've not started to thin yet because they're 21, but they have a very strong history of baldness. Now, what do you do in these cases? Where do you get the grafts from? You might take grafts from here, and suppose the patient is going to end up with diffuse pattern alopecia. The hair on the beard will also disappear. And what if the patient starts to bald? Will he not prioritize hair on his head over his beard, which can be easily shaven off? Will he not now want beard grafts to be harvested and used on the scalp? And this will cause scarring. So going in for a beard hair transplant is a very important decision which should not be taken hastily. No impulsive decisions should be made. Meet the doctor. Tell the doctor that you want to see certain cases only if you are happy with the naturalness of the procedure. Only if you're very confident that you are going to sport a beard for a long period of time. Should you go in for a beard if you're not, number one, a Muslim or a Sikh who are committed to maintain their beard for a lifetime. So you need to think a lot that whether you should go for a beard transplant or not. It is not a decision which is made overnight and next day you are on the operation theatre and undergoing a hair transplant by a doctor who's much too happy that you've come. So remember that hair transplant, beard hair, especially over the facial area, is a permanent procedure. There is no going back. Once the die is cast, you're in it. You cannot say that I was not aware of all this, because you're going to be signing a consent form, an informed consent form. So it's only you who has to be blamed. And of course, ethically, the doctor also has to carry the blame, who, without making you understand the pros and cons of the procedures, put the knife on your skin, on the face, the beard. But once you sign, he has grown his hair. How unnatural it looks, it will all depend upon his ethics, his work ethics, whether he will accept what he's done or he will not. Other points to note while harvesting grafts from the beard is the mismatch of color. Many patients will have different color of the beard and different color of the scalp donor. So when you transplant, you have to be aware that the color of the scalp donor hair will be different and different from the existing beard native hair. So this you can discuss with your doctor. There is no problem. You can always dye it any color you want. Is FUE used or FUE hair transplant will be used for beard hair restoration? Well, FUT hair transplant, FUT method can be used for extraction from the scalp donor. But when we do beard hair, when we harvest beard hair, it is only an FUE technique. But more and more clinics do FUE technique harvesting for the beard hair transplant, both from the scalp donor and the beard donor from the submandibular area. FUT has mostly been phased out. Very important point, when you use an implanter pen for the beard, implanter pen does not allow you to follow the curl of the hair. It is just impossible because this graft is sitting inside the implanter and you do not know which side it faces. So use implanter pens very diligently, very carefully, if at all. But the best method for beard hair transplant, facial hair transplant is not implanter pens. Free hand technique while transplanting in facial areas is the best method to do a hair transplant. So what are the side effects that can happen because of beard hair transplant? A beard hair transplant can completely look unnatural if the aesthetic units of the beard restoration are not kept in mind. There are certain areas where the beard has to be, there are certain areas beard is not supposed to be. So the doctor should know where the beard should be and what are the limits of the mustache area, what are the limits of the beard, what are the limits of the sideburns. And it should look very natural. It should not transform the patient into an ape look. The next is hair angulation. Hair angulation, firstly direction of the slits, and secondly following the curl of the hair. Every graft has its natural curl. So the curl has to be facing downwards, that is, it has to be concave downwards, so that it looks natural, not that it is anyway, it will look like a disorderly beard. And then cobblestoning. If the grafts are placed deep below the skin surface, they will cause tenting of the skin, which is cobblestoning. Cobblestoning over the head, if it happens, can easily be hidden, but it is very difficult, even in a full beard, along the leading edges, to hide cobblestoning. This can be a great distraction. Everybody will be looking at your cobblestones rather than at your face and say that how beautiful your beard looks. Then we can have ingrown hair. If the hair is not planted properly, there could be ingrown hair and there could be resultant cysts which might break out from time to time and create problem for you. And then over harvesting of the beard donor and over harvesting of the scalp donor. So these are the things that you have to be careful about. Choose a doctor, choose a clinic with due diligence, do a lot of research, and also consider whether beard hair transplant is actually for you or not. Discuss it with your parents, discuss it with your seniors, discuss it with your colleagues and friends. And only after you have made the decision, only after you've seen cases whose hair transplant has been done, beard hair transplant has been done, should you approach the clinic you've chosen and book a procedure, not otherwise. So that was the talk for the day about beard hair restoration. If you have any questions about hair transplants, about hair loss treatment for men and women, which you want addressed in the upcoming sessions of the live session that I do every day, do let me know. I'll be too happy to oblige. Have a nice day and God bless you.